Ebola hemorrhagic fever is a virulent disease that weakens the immune system. It is prevalent in West Africa and is spread through contact with blood or bodily fluids. Its symptoms include high fever, diarrhea, vomiting, severe bleeding, and pain. Doctors still have a lot to learn about Ebola, and there are currently no vaccines or treatments for it. More research needs to be done, and because animals and the environment play pivotal roles in the transmission of Ebola, we will be using the One Health approach to tackle these aspects of the disease. Transmission of Ebola among animals is a problem because it increases the infection among humans. Bats are reservoirs of Ebola, and when fruit is abundant, Ebola-carrying bats gather to eat with primates and can easily infect them. With the increase in roads, logging, and slash-and-burn agriculture to increase deforestation, it's easier for people to enter forests and get infected by these animals. People in West Africa don't realize that their cultural practices are a danger to them. Their burial practices involve close contact with the deceased Ebola victim as they wash and dress their body and touch their face one last time during the funeral. Thankfully, countries such as Sierra Leone are practicing safer burials. Bushmeat hunting is also a problem. When people come into contact with Ebola-infected gorilla carcasses or eat infected bat meat from markets, they also become infected. Bushmeat hunting will be hard to stop because people rely on bushmeat for food where domesticated meat isn't available. Climate change is making the environment a key player in the spread of Ebola. Heat and droughts fuel forest fires that would lead to forest fragmentation and drive wildlife closer to humans. Droughts and floods will affect crop yield, sometimes resulting in malnutrition, which would make people more vulnerable to the disease.
A bottom-up approach in this situation must start with individual cases, which progressively grows into a network of information and data that can be used to simplify the treatment of Ebola and turn into regulation by the government. The approach proposed would be to tackle the problem of the disease by dividing it into two separate categories, physiological and social. Physiologically, we should gain as much attainable biological information from the survivors as possible. Socially, we know that Ebola survivors are at times shamed and socially inhibited from using Western medicine. Further investigation of the social effects of Ebola would be pursued using focus groups and other methods of obtaining social data. Through implementation of policies and government regulation, education for the public about the disease, and individual help for the survivors, the havoc caused by Ebola in West Africa will decrease. Once successful, we can spread this information to other countries.
Despite the efforts of modern medicine, much is unknown about the long-term effects of Ebola and whether or not survivors are free of its morbid effects. In addition to this, survivors have not been properly cared for and the negative stigma surrounding Ebola has only grown. This is largely due to a dysfunctional healthcare system, ignorance among the community, unavailability of drugs, and a growing uncertainty behind possible reservoir species. Through collaboration with local government, policymakers, and community leaders, we hope to increase the funding of West Africa's healthcare system, recruit more healthcare professionals, widen the variety of private health coverage, and develop a new standard of care. In addition, we will also pursue research to develop a drug to fight the effects of Ebola and understand how climate change, reservoir species, and drought may aid in its transmission.
Governments in many West African countries have started campaigns distributing information door to door or through radio and television advertisements. The ad campaigns will also aim to help reduce the stigmatization of the survivors and give more general knowledge on the disease, including risks that the survivors pose such as semen and breast milk transmission. We can also hold public forums to educate the communities about the risks of Ebola without inviting fear, educating children at local schools to stop the stigmatization at an early age, and enlisting local leaders to exert their influence to help end the stigmatization. Additionally, outreach groups will be visiting the villages and providing care packages and giving workshops on the lingering symptoms of the survivors, including semen transmission of Ebola. Meeting with villagers in person allows us to build the relationships and trust needed when communicating to them about the risks of deforestation, climate change, and bushmeat consumption. Even though these game animals are more accessible to humans, we need to educate them to stay away because they will get infected from eating infected animals. Our goal is to educate villagers by splitting them into focus groups with who they are comfortable with and providing them information through workshops. These workshops will reduce any rumors, reduce the stigmatization of Ebola survivors, and increase the health and safety of the villagers through first-hand education.
Even though Ebola is no longer an international concern, the countries in West Africa need help getting back on their feet. They are still struggling with poor healthcare systems, lack of safe food, and lingering symptoms. Please donate to the Red Cross, Doctors Without Borders, and the World Health Organization. And please volunteer to help and spread awareness for the health and safety of the Ebola survivors in West Africa.